Hey, and welcome to Medibles, where I talk about medicine, mindset, wellness, and so much more. I hope you stick around with me and learn something new today. Now let's take it to the whiteboard, where I will delve into what Crohn's disease is, its causes and symptoms, complications that may arise because of the condition, as well as its management and treatment. Crohn's disease is classified as an inflammatory bowel disease, also known as IBD, that causes chronic inflammation of the gastrointestinal tract. The term IBD consists of two conditions, Crohn's disease and ulcerative colitis, which I will make a video on in the future. I will also make a video comparing the two conditions, so be sure to stay tuned to future videos. The exact cause of Crohn's disease remains largely unknown, but it is thought to be due to a combination of environmental, genetic, immune, and bacterial causes. Although Crohn's results in a chronic inflammatory state and there is an immune component to the condition, Crohn's itself is not considered to be an autoimmune condition. Crohn's can cause inflammation of any part of the gastrointestinal tract, however, some areas seem to be more commonly affected, such as the small and large intestines. It is estimated that approximately 3 million Americans have IBD, and over 500,000 of them suffer from Crohn's disease. One of the known risk factors for the development of Crohn's disease is smoking. The typical age of onset of Crohn's disease is between the ages of 20 to 30 years old, and those affected may actually have symptoms for years prior to getting a proper diagnosis by a physician. Symptoms of Crohn's can present in a relapsing and remitting manner, meaning that individuals may have symptoms for several years followed by a period of experiencing no symptoms at all. The symptoms of Crohn's can vary from person to person because it can affect any area of the digestive tract. However, some of the more common symptoms that may be experienced are abdominal pain, diarrhea, weight loss, and bloody diarrhea, which can vary in color depending on which area of the digestive tract is affected. Crohn's disease can affect other areas of the body as well. Some of the extraintestinal manifestations that present in Crohn's disease include joint pain/swelling, and skin problems such as erythema nodosum, which are tender bumps that appear under the skin, particularly in the extremities. Eye issues such as uveitis and episcleritis are also seen. These are both conditions that cause inflammation of different regions of the eye. Some of the complications that are known to be associated with Crohn's disease are strictures, fistulas, abscesses, vitamin deficiencies, and perforation of the bowel. Long-term inflammation and scarring from Crohn's disease results in stricture formation, which is essentially the narrowing of a section of the intestine, and this narrowing can then lead to bowel perforation if left untreated. Fistulas are ulcers that form within the intestine walls. Since Crohn's causes malabsorption, it can result in vitamin deficiencies and malnutrition. It is not uncommon to see patients with Crohn's experience weight loss, and as a result, this leads to vitamin deficiencies, particularly fat-soluble vitamins such as A, D, E, and K. Vitamin B12 is another vitamin that can be deficient in patients with Crohn's disease. When it comes to Crohn's disease, there isn't a standard treatment that can be applied to all patients across the board. Management and treatment of the disease depend largely on the severity of the symptoms along with several other factors, such as location and response to medications taken previously. The main drug classes that are used in medical treatment are biological agents, corticosteroids, aminosalicylates, and antibiotics. Aminosalicylates and corticosteroids help prevent the inflammation that presents in Crohn's disease, and antibiotics are used for any infections. Since corticosteroids are not used for long-term treatment of Crohn's disease, that is where the use of biological agents comes into play. If symptoms are severe or not properly controlled by medications or otherwise, surgery may be required. Certain foods may be a trigger for some patients, so figuring out these triggers and eliminating them from your diet can be one way to prevent flare-ups in Crohn's disease. The last thing I want to discuss today, which gave me the idea to do this video in the first place, is a research article I was reading recently. I will link it down below in the description box in case anyone wants to read it. The article suggests a link between the norovirus and Crohn's disease. There have been some data published previously on a possible link between the two. These findings were published by a group of researchers at NYU where they were doing a study on mice that were exposed to norovirus. For those of you who are unfamiliar why norovirus, it is a common virus that causes vomiting and diarrhea. It is usually caused by the ingestion of contaminated food or water sources. So in these mice, the researchers found that the mice that were exposed to norovirus had a greater risk of damage done to their intestines, particularly cells called Paneth cells, which serve as a form of defense for your gut against any sort of infection. These researchers also found that a protein known as apoptosis inhibitor 5, or API5, which is produced by a type of cell in the body known as T cells, may be, in fact, be protective against Crohn's disease. In the research mice, it seemed that norovirus inhibited the API5 protein, which decreased this protective factor. That's all from me today, but if you're enjoying this type of educational content, be sure to like and subscribe to stay tuned for much more to come. If you have suggestions on what you would like to see next, drop it down below in the comments and I'll try to make a video on it. Until next time, bye.